same that was out a few years ago? Is it an extension of that one? Or
Yeah.
is it a totally new report?
Yeah, no, actually, you know what? What's really appalling about it
Mm-hmm.
is the fact that this is really a continuation
Uh-huh.
of the evaluation of the Women's Health Initiative, which is what
Right.
was the study that in 2002 was stopped. And I just want to review it so people know what we're talking about. Is that the Women's Health Initiative was a government-sponsored study that occurred was on 16,000 plus women,
Right.
and it occurred in a lot of academic centers that were doing the study. And it looked at Premarin and Prempro, which are synthetic hormones, which are Premarin comes from it's called conjugated equine estrogen. It's pregnant horses' urine, and Provera, which is a synthetic progesterone, which causes cancer. And these it was supposed to be an 8-year study. The study was stopped short 5 years into it because, shock of all shockers, Premarin and Provera, Prempro, cause cancer, heart attacks, and strokes in the women who were taking the drugs. Now, what I find even more appalling than anything else is that we shouldn't, first of all, the Women's Health Initiative did such a huge disservice to women that to even talk about it is kind of to continue the disservice. And what happened this week was that they kept on looking over an average of 11 years. The researchers, who by the way have nothing to do with clinical medicine, they don't see the patients. They just look at numbers, and that's even more appalling because you're not a number. None of us
So
are
is it
numbers.
mostly researchers who are doing this, or are they doctors? Actually,
Well, they are doctors, but doctors doesn't mean that you're a clinician.
Mm-hmm.
So these people looked at over the course of the following 11 years from when this started, they looked at 13,000 of the original participants of the Women's Health Initiative, and they found that breast cancer related deaths had doubled over the course of the 15 years in the women who were taking the synthetic hormones compared to the placebo.